We all feel the need to double check things like, have I locked my door well? Or have I turned off the stove? But what happens when you feel like checking or redoing the same actions more than 4 times? Then friends, you might just have OCD. Stay with us till the end to find out everything you need to know about OCD for yourself or how to help others that might have it. Let's begin. What is OCD? According to the American Psychiatric Association, Obsessive-Compulsive Disorder is an anxiety disorder in which people have recurring, unwanted thoughts, ideas, or sensations that make them feel driven to do something repeatedly. Difference between obsessions and compulsions. Obsessions are recurrent and persistent thoughts, impulses, or images that cause distressing emotions such as anxiety or disgust. Compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to an obsession. Know that you need a professional diagnosis to be termed someone with OCD. But for now, we have put down some signs and symptoms to help you understand better. Or someone you know possibly have it? Check for these signs. Some individuals with OCD will spend hours of their day cleaning objects or surfaces until their compulsion is met. Checking can become a more disruptive practice for those with obsessive-compulsive disorder. An individual believes that if they repeat something or do something a specific number of times, they will avoid danger. Desire to arrange things in such a manner that it is positioned in a certain way. If the object does not appear to be precisely how they want it to be, they may experience worry or anxiety till corrected. Mental compulsions are often an indication constant thought, such as destructive or distressing ideas that the individual does not want to feel. Are you experiencing any of these? Let us know in the comment section below. How to deal with OCD? If you are suffering signs of obsessive-compulsive disorder, you should speak with a mental health professional. Getting therapy sooner rather than later will help you prevent developing anxiety and discomfort, while also teaching you how to manage your symptoms over time. On a daily basis, you can also do the following. Learn. Learning about your condition can empower you and motivate you to stick to your treatment plan. Find. Self-help resources available online for OCD are designed to help you develop coping strategies. Talk. Discuss your OCD with someone you can trust and also spend time with family and friends. Connect. Making connections with people with similar or shared experience can really be helpful. Relax. Relaxation can help you look after your well-being when you are feeling stressed, anxious, or busy. Sleep. Sleep can give you energy to cope with difficult feelings and experiences. Can you get treatment? Yes, you can. Treatment for obsessive-compulsive disorder may not result in a cure, but it can help you manage your symptoms so they don't take over your life. Some patients may require long-term continuous or more intensive therapy depending on the severity of their OCD. Psychotherapy. Psychotherapy and medication are the two most common therapies for OCD. Treatment is often more successful when a mix of these approaches is used. Have we answered all your questions, or do you have more? Comment below and let us know. Now it's time to spread awareness on this topic, and sharing this video is how you start. For more informative content, subscribe to our channel and hit the bell icon to know when and what next. If you are waiting to learn more, watch our video on what is dyslexia. But before that, make sure to like this video.